Healthcare is one of the biggest concerns for people around the world. Let's compare four healthcare systems: Sweden, China, France, and the United States. Sweden's healthcare system is renowned for its commitment to universal access, quality care, and health equity. It is predominantly publicly funded, with a strong emphasis on primary care and preventive measures. Here are key features and offerings of the Swedish healthcare system. Universal coverage. Every resident in Sweden has access to healthcare services under the universal healthcare system. This coverage is primarily funded through taxation, with both national and local taxes contributing to healthcare financing. Decentralized administration. The healthcare system in Sweden is decentralized, with the responsibility for health and medical services devolved to the regional, county councils, and local, municipalities, levels. This allows for a more tailored approach to meet the specific health needs of each community. Publicly funded. The vast majority of healthcare services in Sweden are publicly funded. The system ensures that high-quality healthcare services are available to all residents, regardless of their income level. Private healthcare providers. While the healthcare system is predominantly public, there is also a role for private healthcare providers. These providers operate within the public health system framework, offering patients additional choices and sometimes shorter waiting times. Primary care focus. Primary care is the cornerstone of the Swedish healthcare system, with an emphasis on preventing illness and promoting health. General practitioners, GPs, serve as the first point of contact for patients, managing most health concerns and coordinating further care as needed. Patient fees. While healthcare costs are heavily subsidized, patients do pay nominal fees for certain services, such as doctor visits, hospital stays, and prescriptions. These fees are capped annually, protecting individuals from high healthcare expenses. High quality and efficiency. Sweden is recognized for its high-quality healthcare outcomes, including long life expectancy and low infant mortality rates. The system emphasizes evidence-based care, efficiency in service delivery, and the use of technology and e-health solutions. Patient rights. Swedish patients enjoy a high degree of autonomy and rights within the healthcare system, including the right to choose their healthcare provider, access to information about their health conditions, and the right to seek a second opinion. Preventive care and public health initiatives. Sweden invests in preventive care and public health initiatives, focusing on reducing risk factors for chronic diseases, promoting healthy lifestyles, and early detection of health conditions. Innovation and research. The Swedish healthcare system supports medical research and innovation, contributing to advancements in medical treatments, pharmaceuticals, and healthcare technologies. Challenges such as waiting times for certain procedures and regional disparities in access to care are continually being addressed through reforms and initiatives aimed at improving efficiency and equity in the system. Overall, the Swedish healthcare model is designed to ensure that every resident receives high-quality care when they need it, without financial hardship. China's healthcare system has undergone significant reforms and improvements over the past decades, aiming to provide accessible, affordable, and equitable healthcare services to its vast population. The system is a mix of public and private healthcare providers, with a strong emphasis on public health and preventive care. Here are key features and offerings of the Chinese healthcare system. Universal health insurance coverage. China has made substantial efforts to achieve universal health insurance coverage through three major public insurance programs: the Urban Employee Basic Medical Insurance, WEBMI, for urban employees, the Urban Resident Basic Medical Insurance, URBMI, for urban non-working residents, and the new Rural Cooperative Medical Scheme, NRCMS, for rural residents. These schemes aim to provide a basic level of healthcare coverage to the entire population. Tiered healthcare delivery system. The healthcare delivery system in China is organized in a tiered structure, ranging from primary healthcare centers at the grassroots level, community health centers and clinics, to highly specialized hospitals at the provincial and national levels. This system is designed to promote primary care and prevent the overutilization of tertiary hospitals. Public hospitals predominate. The majority of hospitals and clinics in China are publicly owned. These public hospitals are the backbone of healthcare delivery, providing a wide range of services from primary care to specialized treatments. Private healthcare sector growth. In recent years, China has seen significant growth in its private healthcare sector, including private hospitals and clinics. This growth is partly driven by increasing demand for higher quality services and shorter waiting times. Healthcare reforms for efficiency and accessibility. China has implemented several healthcare reforms to improve efficiency, reduce healthcare costs, and increase accessibility. These reforms include the introduction of a national essential drug system, healthcare insurance reform, and pilot programs for public hospital reform. Basic public health services. The Chinese government provides a package of basic public health services free of charge, which includes preventive services, health education, immunizations, maternal and child health services, and disease control and prevention. Out-of-pocket payments and reimbursement rates. Despite the expansion of health insurance coverage, out-of-pocket payments remain a significant component of healthcare financing in China. The reimbursement rates vary by insurance scheme and type of service, with rural residents and those with lower incomes generally facing higher out-of-pocket expenses. Digital health innovations. China is at the forefront of integrating digital technologies into healthcare, including the use of AI in diagnostics, telemedicine, electronic health records, and mobile health apps. These technologies are improving access to healthcare services, especially in remote and rural areas. Challenges in access and quality. Despite improvements, disparities in healthcare access and quality between urban and rural areas, and among different regions, remain a challenge. Efforts are ongoing to address these disparities and improve the overall quality of healthcare. Public health and epidemic response. China has a robust public health infrastructure and has gained considerable experience in managing public health crises, such as the SARS outbreak in 2003 and the COVID-19 pandemic. The government has focused on strengthening public health systems, surveillance, and response capabilities. China's healthcare system continues to evolve, with ongoing reforms aimed at improving healthcare quality, accessibility, and affordability for its population. The government's commitment to health insurance expansion, public health, and integration of digital technologies are key components of its strategy to meet the healthcare needs of its citizens. France's healthcare system, often ranked among the best globally, is renowned for its efficiency, accessibility, and quality of care. It operates on principles that ensure universal coverage, a mix of public and private service providers, and a reimbursement system that allows patients a great deal of freedom in choosing their healthcare providers. Here are key features and offerings of the French healthcare system. Universal coverage. France provides universal healthcare coverage to all residents through a system funded by government national health insurance. Contributions to this insurance are based on income and are collected through taxes. Public and private healthcare providers. The French healthcare system comprises both public and private healthcare providers. Public hospitals account for a large portion of hospital care, but private hospitals and clinics also play a significant role, especially in providing specialized services. Reimbursement system. Patients in France typically pay for healthcare services up front but are reimbursed a significant portion of the cost by the national health insurance. The reimbursement rate varies depending on the type of service, with essential medical services and prescriptions having higher rates of reimbursement. Complementary health insurance. While the national health insurance covers a large portion of healthcare costs, many residents also opt for complementary health insurance, mutuelle, to cover the remaining costs not reimbursed by the state. This additional insurance is often partially subsidized by employers. Liberté de choix, freedom of choice. One of the hallmarks of the French system is the freedom for patients to choose their healthcare providers, including general practitioners and specialists, without the need for a referral. High-quality care. France is known for its high standard of medical care, with a well-developed hospital network, advanced medical technology, and a high ratio of healthcare professionals to population. It also has strong preventive care services and comprehensive public health initiatives. Carte Vitale. The Carte Vitale is a health insurance card that simplifies the reimbursement process. It contains all the insured's administrative information, allowing for direct billing between healthcare providers and the national insurance system. Établissements de santé, healthcare establishments. France has a wide network of healthcare facilities, including public hospitals, hôpitaux, private hospitals, cliniques, and primary care providers. This network ensures that healthcare services are accessible throughout the country. Healthcare for all residents. Beyond citizens, The French healthcare system covers all residents, including foreign nationals living in France on a long-term basis, ensuring that access to healthcare services is not limited by nationality. Innovation and research. France is at the forefront of medical research and innovation, with significant investments in healthcare technology, pharmaceuticals, and medical research. This commitment helps maintain the high quality of care for which France is known. Despite its strengths, the French healthcare system faces challenges such as managing healthcare costs, addressing the shortage of healthcare professionals in certain areas, and reducing waiting times for certain procedures. Nonetheless, the system's foundation on universal coverage and quality care continues to make it a model for many countries worldwide. The healthcare system in the United States is complex and multifaceted, characterized by a mix of public and private sector involvement. Unlike many other developed countries, the U.S. does not have a universal healthcare system, but rather a combination of various healthcare coverage and service providers. Here are key features and aspects of the U.S. healthcare system. Private health insurance. A significant portion of the population is covered by private health insurance, which is often provided through employers. Private insurance plans vary widely in terms of coverage, premiums, deductibles, and out-of-pocket costs. Public programs. The government runs several major health insurance programs, including Medicare, Medicaid, and the Children's Health Insurance Program, CHIP. Medicare provides coverage primarily to people aged 65 and older, regardless of income, while Medicaid and CHIP provide coverage to eligible low-income families, children, and individuals, including some low-income adults, pregnant women, elderly adults, and people with disabilities. Affordable Care Act, ACA, enacted in 2010, the ACA, also known as Obamacare, aimed to reduce the number of uninsured Americans through individual health insurance mandates, the creation of health insurance marketplaces, and the expansion of Medicaid. It also implemented consumer protections, such as prohibiting insurers from denying coverage due to pre-existing conditions. Out-of-pocket costs. Patients often face significant out-of-pocket costs, including deductibles, co-payments, and co-insurance, even with insurance coverage. These costs can be a barrier to accessing healthcare for some individuals. Healthcare providers. The U.S. has a diverse array of healthcare providers, including private and nonprofit hospitals, individual healthcare practitioners, and specialized care facilities. The system is known for its high level of medical technology and innovation. Pharmaceuticals and drug pricing. The U.S. is a leader in pharmaceutical research and development, but it also has some of the highest drug prices in the world. This is partly due to the lack of government regulation of drug prices. Healthcare disparities. There are significant disparities in healthcare access and outcomes across different populations in the U.S., influenced by factors such as socioeconomic status, race, and geography. Healthcare spending. The U.S. spends a higher portion of its GDP on healthcare than any other developed country, yet it does not always achieve better health outcomes. High healthcare costs are a concern for individuals, employers, and the government. Reform and debate. Healthcare is a major political issue in the U.S., with ongoing debates about how to improve access, reduce costs, and improve the quality of care. Proposals and opinions vary widely, from expanding public healthcare coverage to further deregulating the healthcare market. Innovation and quality of care. Despite its challenges, the U.S. healthcare system is known for its high-quality care in many areas, particularly in advanced medical procedures and treatments, research, and medical technology innovation. The U.S. healthcare system's complexity and diversity mean that experiences with healthcare can vary greatly depending on an individual's insurance coverage, location, and socioeconomic status. Efforts to reform the system continue to evolve, with a focus on improving access, affordability, and outcomes.
In a world brimming with voices, Necessary Dialogue stands out as your go-to podcast, diving deep into the heart of social issues that shape our existence. We tackle everything from environmental challenges to social justice, exploring topics that ignite passion and drive change. And for the storytellers among us, Authors looking to promote their books that resonate with these themes find a special spot in our dialogue. Are you curious? Inspired? An author with a vision? Find us and connect through the email in our About page. Necessary Dialogue isn't just a podcast. It's a beacon for understanding, action, and unity. Tune in, contribute your voice, and let's spark the necessary conversations today for a brighter tomorrow.